Hello and welcome to Tender Loving Care Training Academy, where we explore various topics related to health and wellness. In today's video, we are going to learn about how medical social health workers solicit for their clients, what are the ethical and legal issues involved, and what are some best practices to follow. How do medical social health workers solicit for their clients? Medical social health workers are professionals who provide psychosocial support and services to patients and their families in healthcare settings. They help patients and families cope with the emotional, social, and financial impacts of health and illness. They also advocate for the rights and interests of patients and families in the healthcare system. Medical social health workers usually receive referrals from other healthcare providers, such as doctors, nurses, therapists, or case managers, who identify patients and families who may benefit from their services. However, sometimes medical social health workers may need to solicit for their clients, that is, to actively seek out and offer their services to potential clients who may not be aware of their needs or the availability of the services. What are the ethical and legal issues involved? Soliciting for clients can be a challenging and sensitive task for medical social health workers, as it involves ethical and legal issues that need to be considered. Some of these issues are: informed consent. Medical social health workers should respect and promote the right of clients to self-determination and informed consent. This means that they should explain the purpose, risks, benefits, and alternatives of their services and obtain the client's voluntary and written agreement before providing any services. Confidentiality. Medical social health workers should protect the privacy and confidentiality of their clients and their information, and only disclose it with the client's consent or when required by law. This means that they should not solicit for clients in public or in front of other people, and they should not reveal any identifying or sensitive information about their clients without their permission. Boundaries. Medical social health workers should maintain appropriate professional boundaries with their clients and avoid any conflicts of interest, dual relationships, or exploitation. This means that they should not solicit for clients from their own personal, social, or professional networks, and they should not use any coercive, deceptive, or manipulative tactics to persuade clients to accept their services. Competence. Medical social health workers should provide services only within their scope of practice and level of competence, and refer clients to other professionals when necessary. This means that they should not solicit for clients who have needs or issues that are beyond their expertise or training, and they should not make any false or exaggerated claims about their qualifications or the outcomes of their services. What are some best practices to follow? Soliciting for clients can be a beneficial and ethical practice for medical social health workers, as long as they follow some best practices that ensure the quality and integrity of their services. Some of these best practices are: be respectful and courteous. Medical social health workers should approach potential clients with respect and courtesy, and respect their right to decline or terminate the services at any time. They should also respect the cultural, linguistic, and individual preferences of their clients and use clear and understandable language to communicate with them. Be informative and transparent. Medical social health workers should provide accurate and complete information about their services, including the goals, methods, costs, and duration of the services, and the expected roles and responsibilities of both parties. They should also inform the clients about the limits of confidentiality, the possible risks and benefits of the services, and the client's right to file a complaint or appeal if they are dissatisfied with the services. Be collaborative and supportive. Medical social health workers should work collaboratively and supportively with their clients and involve them in the assessment, planning, implementation, and evaluation of the services. They should also work cooperatively and respectfully with other healthcare providers and coordinate the services with them to ensure the best outcomes for the clients. Be ethical and professional. Medical social health workers should adhere to the ethical and professional standards of their profession and follow the laws and regulations of their practice setting. They should also seek supervision and consultation when needed and engage in continuing education and professional development to enhance their knowledge and skills. Conclusion. Soliciting for clients is a practice that can help medical social health workers reach out and offer their services to patients and families who may need them, but it also involves ethical and legal issues that need to be considered and addressed. By following some best practices, medical social health workers can solicit for their clients in a respectful, informative, collaborative, and ethical manner and provide quality and effective services that promote the well-being of their clients. Thank you for watching this video, and don't forget to subscribe to our channel for more videos like this. See you next time.